Most people associate radioactive materials with weapons and power stations. But whilst radiation can be harmful, in a branch of science known as nuclear medicine, it is used to help patients in diagnosis and treatment. And now, with the very latest research, nuclear medicine is even offering hope against some of our most dangerous diseases. From emergencies to routine checks, the busy wards of Britain's hospitals are open 24 hours a day, 365 days a year. Every year, some 12 million people pass through them. On the surface, it doesn't seem like a likely setting to find a nuclear scientist, but Dr. Val Lewington is a unique type of doctor.
I'm a consultant in nuclear medicine here at the Royal Marsden. I came into nuclear medicine from being a general physician and then specialised. And the beauty of nuclear medicine is that it's one of the few specialties that allows you to mix with a whole team of people from different disciplines. So there are the medics, but there are also nurses, radiographers, technicians, scientists, and you get to be at the very cutting edge of development in a very interesting area of medicine.
The research of teams like these is changing lives, especially for patients like Suzanne Richmond.
Originally I had some lumps, one starting under my arm and in the groin, and went to the hospital. Then they decided to do a biopsy to see what was causing it, and that's when I was diagnosed with lymphoma.
Lymphoma, like all cancers, is caused when cells start to multiply and grow uncontrollably, forming tumours. In the case of lymphoma, the tumours grow in the lymph system, a complex network of tubes, rather like the bloodstream, that helps to transport substances from place to place around the body. The usual treatment for this disease is a course of chemotherapy, which involves taking drugs that work by poisoning cancer cells so that they don't divide and produce new cells.
Because the chemotherapy attacks all your cells in your body, good and bad, it makes you feel pretty grotty. Added to that, you have things like steroids attached to it, and it does make you feel really rough.
But not all cases of lymphoma respond well to chemotherapy, and it wasn't long before Suzanne was having to return to hospital to discuss what her options might be.
Hello, Suzanne. Obviously, it's disappointing that the disease is still present on the scan. I mean, just to recap your treatment, you have had the conventional chemotherapy, which was a long time ago. Unfortunately, as we expected, there is still evidence of lymphoma there, and we have to decide what to do. And I think we should explore other options, including perhaps radiotherapy, which we haven't used yet, and lymphoma cells can still be sensitive too.
We all know that radiation can be harmful, but used in the right way, it can also be beneficial, and its cancer-killing properties have been known for some time.
We've been using radiation in medicine for many years now, and so we know a lot about the potential risks and benefits of radiation exposure. We know, for example, that very high doses of radiation will damage DNA so badly that we stop cells from dividing. And obviously, in terms of cancer treatment, that's exactly what we're trying to achieve. But on the other hand, lower doses of radiation can sometimes cause DNA damage, but not prevent the cell from dividing. That means that potentially minor DNA abnormalities could be replicated in later generations of cells, and in the long term, that might lead to the risk of inducing new cancers.
This difference is key in treating patients like Suzanne. Depending on the type and dose of radiation used, it can be useful, destroying DNA to kill unwanted cancer cells, or harmful by causing mutations that can trigger cancer. To treat Suzanne successfully, scientists would have to identify the most useful type of radiation to use and then work out how to deliver it. When scientists first began to look at how to use radiation in medicine in a safe way, they were helped by the fact that there are 3 types of radiation, all with differing properties. Alpha radiation is absorbed by paper, as it is not very penetrating. Beta radiation gets through paper or a thin layer of cells, but is absorbed by aluminium or plastic. Because it is very penetrating, gamma radiation is only absorbed by several centimetres of lead and can pass right through the body. Understanding these properties has helped scientists develop different ways to use radiation in the treatment of cancer and other diseases. Scientists working on treating lymphoma had a very exact problem to solve. They had to find a way of delivering a dose of radiation inside the body that would kill the cancer cells whilst leaving patients like Suzanne unharmed.
Right, William, what I'm going to do now, I'm going to connect these transfers.
Gamma radiation, the most penetrating type, was already being used safely by specialists in the treatment of skin cancer,
The radioactive source is going
who deliver the minimum effective dose to just the area that needs to be treated.
Mr. Mackenzie, just going to fit this shell.
Yeah.
The first step in ensuring this is to create a plastic shell that fits over the area to be treated. The doctor has already marked this area on the patient's hand, and this is then traced onto the shell.
Okay, Mr. Mackenzie, I'm just going to trace through where you're going to be treated.
Plastic guides are then attached to the shell directly over the area that needs to be treated. Tubes can then be passed through the guides to prepare the shell for treatment.
We will then calculate how many times we want the radioactive source to sit on the shell in order to give a nice even dose of radiation to the area that is being treated. We need enough radiation to be able to kill off the cancer cells, but not to kill off the normal cells, because we want the normal cells to reproduce so that the area will heal.
This machine contains a wire of radioactive iridium that constantly gives off gamma radiation. So the dose of radiation is determined by the amount of time the iridium tip is placed over the hand. The shell ensures that the radiation dose is only directed at the cancer cells, and the rest of the body receives a dose that's known to be within safe limits.
Right, William, if you could just move your hands.
This type of treatment, which delivers radiation outside the body, is known as brachytherapy. And the simple mould method is a very successful way of ensuring that the radiation is only administered to exactly where it is needed.
Hi Elaine, how are we getting on there?
But how could this treatment be adapted to treat a cancer like Suzanne's lymphoma? Lymphoma cancers are found deep within the body.
Okay, right, yeah.
What was needed was a way of targeting radiation to the exact site inside the body where the cancer cells were reproducing.
Okay then.
Targeting is really the most logical way forward with radiation treatment, because we know that we're going to get a high radiation dose exactly where we want it, but we're not going to be damaging other tissues in the body. The real breakthrough came with the realisation that radioactive iodine would be a very good way of treating thyroid disease.
The thyroid is a gland in the neck which produces hormones that help regulate how your body works. If it is too big or too small, you may have a problem.
The thyroid naturally uses iodine as the building block to make thyroid hormones. And so if we give someone some iodine, it will automatically home in on the thyroid, get trapped by the thyroid and locked into it, and then give a local dose of radiation precisely where we want it to be.
The radioactive form of iodine, iodine-123, gives off gamma radiation. Remember, gamma radiation is very penetrating, so even from deep inside the body, the gamma rays can pass through all the body's tissues and be detected from outside the body. Because of this, the radiation can be detected by a machine known as a gamma camera, which creates images of the thyroid. Checking for problems in the thyroid by using a gamma camera involves a team consisting of a radiopharmacist and a radiographer. The radiopharmacist is responsible for drawing up a dose of radioactive material, in this case iodine-123. The team set the dose so that enough radiation is emitted for the procedure to be effective, but the level of radiation exposure to the patient is kept to an acceptable level. This is checked using a dose calibrator that can detect the level of radiation from within the cabinet. Although the gamma radiation given off by this syringe is safe for a one-off dose to a patient, if you are exposed to it every day, it could have a damaging effect. So to prevent this, the radiopharmacist works behind a lead glass shield. Inside the cabinet, protecting his hands, he draws the radioactive material from a lead pot into a lead-shielded syringe. These precautions will also have to be adopted by the radiotherapist, who will also double-check the dose before it is finally injected into the patient.
I'm drawing up a radioactive dose from this vial to inject into the patient for her thyroid scan. The vial of radioactivity is housed within a lead pot, and I'll be drawing up into a syringe housed in the lead shield. And the whole process is done behind this bigger lead shield, and there's a lead glass window here for me to look through so that I can see what I'm doing. My hands have to be close to the radioactive vial, and my hands are monitored on a monthly basis to make sure that I don't get a high radiation dose.
Once injected, the radioactive iodine collects in the thyroid and gives off the gamma radiation, which will pass through the cells, emerging from the body, where it can be picked up by detectors in the gamma camera.
Having been injected with the radioactivity, gamma rays will be emitted from the patient, and this head has a mechanism inside it that allows us to detect the presence of the gamma rays and produce a digital image. These are the pictures of the patient's thyroid gland that we took earlier on the gamma camera. The dark areas indicate areas where the radiopharmaceutical has been taken up into the thyroid gland, which shows that it's functioning. The lighter area on this side is an area where there isn't any radiopharmaceutical, so the gamma camera hasn't been able to detect anything, and that shows an area of non-functioning thyroid tissue, and that could be caused by a variety of reasons.
It's a bit scary to think that there's tumours all over your body. It is a bit frightening because you know that you can have it anywhere and you not be aware of where it actually is without a scan or whatever. And obviously it's quite difficult to eradicate that.
Researchers working on lymphoma cancer began exploring the idea of targeted radiotherapy so successful in thyroid disease. And Suzanne was also about to benefit from another breakthrough in nuclear medicine. In the last few years, there have been some incredible developments using radioactive materials in scanning. This is thanks to the development of something called positron emission tomography, or PET scanning. A PET scan detects gamma radiation, just like in the gamma camera, but is much more sensitive, and different radioactive isotopes can be used to investigate different parts of the body.
PET scanning shows you the physiology of the body, so if you can target a specific area or a specific tumour type, then you can see it very clearly in a way that's different from anatomical imaging, which relies on size or shape or density.
And PET has a special way of being able to pinpoint active cancer cells.
You can label a radioactive molecule to a glucose molecule, and cancer cells use more glucose than ordinary cells, and so more of the radioactive glucose will go into the cancer cells, which allows us to see them clearly above the normal background. This is the PET scan that you'd get using radioactive glucose on a patient, and the dark areas indicate parts of the patient's body that is metabolizing more glucose than the normal tissue should, and that would indicate that there's some disease in those areas.
It would be a PET scan that would reveal to Suzanne's doctors exactly where her lymphoma cancer was active.
Okay, Suzanne, we have got your latest PET scan back, and I'm sure you're anxious to know the result of that. As we expected and perhaps didn't want to see, there are these two hotspots of activity here and here.
Yeah.
The doctors knew where to target a treatment. All they needed now was a way of delivering it.
Dr. Potter first mentioned targeted radiotherapy a long time before it was available in the UK. I understood that this treatment with the radioactive isotope attached to it would actually target the bad cells rather than the good cells, so it's going to be a positive thing in that respect.
There is this new treatment, which I know I've talked to you about previously, which is a form of targeted radiotherapy, and I think we should consider that.
Okay, how does that work?
The radiotherapy is in the form of a chemical which is linked to an antibody molecule, and the antibody is a protein which will specifically bind the lymphoma cells here and here, but leave the rest of the cells in the body alone. It won't bind those because it's recognising a protein that's only present on the lymphoma cells. And then the radioactive chemical will emit the radiation that kill off the lymphoma cells in that area, and we'll see by doing further scans whether we get a response.
Okay.
Hello, Suzanne. Already?
This new therapy offered hope to Suzanne because antibodies can flow all round the body, locking onto lymphoma cells wherever they come into contact with them.
And again, draw the contents.
And in targeted radiotherapy, the antibodies have an atom of yttrium-90 attached to them that emits beta radiation. Because beta radiation only penetrates cells for 5 millimetres, it only has an effect on the cancerous lymphoma cells to which it's delivered.
Yeah, I feel absolutely fine. Good. Chemotherapy makes you feel very, very ill because it's hitting good cells and bad cells. This treatment hasn't made me feel ill in that respect at all. If it can actually bring benefits, then it's obviously got to be a good thing. If people don't go into researching this, then people like me could be dead years ago, and it's only through the research that's been carried out that I'm here today, and hopefully I'll be here in 10 years' time.
For the teams that work in nuclear medicine, developing the techniques that help treat patients like Suzanne is one of the most exciting aspects of the job.
Nuclear medicine has to be one of the best kept secrets in medicine in terms of the potential for expansion over the next few years. I think it's one of the most exciting career opportunities in medicine for a whole range of different disciplines. You really are at the cutting edge of everything that's new in the field.